Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're unpacking natural strategies to manage sinusitis, a condition that sends millions of Americans searching for relief every year.
I'm Alara Sky, and throughout this episode, we'll explore why your sinuses matter, what triggers inflammation, and which simple at-home steps, many drawn from Dr. Mercola's latest analysis, can ease congestion without pharmaceutical side effects.
Let's frame the challenge. About 31 million people in the United States experience sinusitis annually, and roughly 16 million seek outpatient care. Yet, standard prescriptions or surgery often add unwanted complications rather than addressing root causes.
Exactly. Sinusitis arises when the 8 cavities in your skull, 4 paired sinuses, become inflamed. These spaces normally humidify and filter every breath, trap pollutants, and even cushion the brain during impacts, but swelling blocks drainage and sparks pain.
Common symptoms include a stuffy or runny nose, postnasal drip, facial pressure, fever, headaches, and an irritating cough. Why do so many people still default to quick-fix medications instead of therapies that resolve the underlying inflammation?
Convenience and marketing play roles, yet natural approaches can be just as fast while avoiding adverse reactions. Today we'll cover evidence-based remedies, nasal irrigation, steam, hydration, environmental tweaks, targeted foods, and a fascinating compound called DMSO.
Let's start with saline nasal irrigation, often performed with a neti pot. How does flushing salty water through the nasal passages provide relief?
The isotonic solution thins and washes away stagnant mucus, pollen, and microbes. Using filtered, lukewarm water mixed with non-iodized salt, tilt your head over a sink and gently pour through one nostril, letting it exit the other, then repeat.
Another widely recommended tactic is steam therapy. Walk us through a safe routine and why warm vapor helps.
Position your face above a bowl of hot, not boiling water, draping a towel to trap steam, and inhale for 5 to 10 minutes. Moist heat loosens secretions, calms membranes, and, when you add a drop of eucalyptus oil, offers mild antimicrobial action.
Staying hydrated seems basic, yet many overlook it. What role does water play when sinuses are inflamed?
Adequate fluids keep mucus thin and mobile. Dehydration turns it glue-like, encouraging bacterial growth. Aim for clear or lightly tinted urine throughout the day, and pair hydration with periodic warm compresses over cheeks and forehead to reduce pressure.
Environmental triggers, especially mold, often perpetuate chronic sinus problems. How can listeners lower that burden inside their homes?
First, repair leaks promptly, run exhaust fans in bathrooms, and consider a HEPA filter. Regularly wiping visible mold with diluted vinegar helps, but long-term success hinges on maintaining indoor humidity between 30 and 60%.
Speaking of humidity, many sleep better when the air is slightly moist. Yet you also stress head elevation at night. Why do both strategies matter?
Propping your upper body on an extra pillow lets gravity drain mucus instead of pooling. A small cool mist humidifier then prevents nasal passages from drying out, striking a balance that supports overnight healing without fostering mold.
Sunlight deserves a mention because lower vitamin D levels correlate with worse sinus outcomes. What exposure guidelines do you suggest?
Midday sun, between 10 a.m. and 2 p.m. For roughly half the time, it takes your skin to pink, several times a week, usually suffices. Beyond vitamin D, sunlight triggers nitric oxide production and circadian benefits that indirectly bolster immunity.
Essential oils are popular add-ons. Peppermint's cooling effect often gets praise. How should listeners incorporate oils safely?
Use 1 or 2 drops in a diffuser or steam bowl. Avoid direct undiluted nasal application. Peppermint, eucalyptus, or tea tree oils can open airways, but always verify quality and patch test to prevent irritation.
Let's pivot to dietary allies. You highlight garlic, onions, ginger, and turmeric as anti-inflammatory staples. How do they work together?
These foods share sulfur or polyphenol compounds that downregulate inflammatory pathways and thin mucus. Incorporate raw garlic or aged black garlic into salads. Sauté onions lightly, Brew fresh ginger tea and season meals with turmeric plus black pepper for absorption.
Many dislike raw garlic's intensity. Does aged black garlic truly retain benefits without the pungent bite?
Yes. Fermentation transforms allicin into stable antioxidants, delivering immune support with a sweet, savory flavor. It's an excellent option for anyone sensitive to fresh cloves.
Onions and ginger also earn praise. Could you quantify their impact?
Quercetin in onions counters histamine responses, easing swelling, while gingerols in ginger act as natural antihistamines and support circulation, accelerating the clearance of excess fluid from sinus tissues.
Pineapple introduces bromelain, and chili peppers offer capsaicin. How do these unique enzymes and compounds alleviate congestion?
Bromelain breaks down fibrin and reduces mucus viscosity, whereas capsaicin stimulates nerve receptors, thinning secretions, and briefly boosting airflow. Even a modest serving, say a few pineapple rings or a sprinkle of cayenne, can deliver noticeable relief.
You also mention horseradish and coconut oil. They seem quite different, one fiery, one fatty. What unites them?
Both possess antimicrobial activity. Horseradish's sulfur compounds clear passages almost instantly. Coconut oil's lauric acid disrupts viral and bacterial membranes. Swallow a teaspoon of virgin coconut oil, or add grated horseradish to a savory dish.
Citrus fruits round out the list because of vitamin C. Is simple daily intake sufficient, or do high doses matter?
For most, integrating oranges, grapefruits, or lemons throughout the day maintains plasma vitamin C well above deficiency thresholds, supporting white blood cell function without megadoses. Whole fruit also supplies water and fiber, extra bonuses.
You suggest a homemade herbal tea combining cloves, black pepper, ginger, basil leaves, and raw honey. What does this blend accomplish?
Cloves and black pepper introduce eugenol and piperine, respectively, enhancing circulation. Basil adds anti-secretory effects. Ginger calms inflammation, and raw honey offers mild antibacterial support, plus palatability. Sip slowly while warm for best results.
Now, to a compound some listeners may find unfamiliar. Dimethyl sulfoxide, or DMSO. Give us the origin story.
DMSO was first synthesized in 1866 from oxidized dimethyl sulfide, a byproduct of wood pulp processing. Although naturally derived, its medical applications emerged in the 1960s when researchers noticed profound anti-inflammatory and analgesic properties.
Clinical evidence specific to sinusitis is compelling yet underreported. Can you summarize key findings?
In one series, 7 sinusitis patients received dilute intranasal DMSO. 5 achieved excellent outcomes and 2 good outcomes. Russian trials using 10% DMSO with localized oxygen therapy resolved infections in 49 of 52 children, outperforming standard care.
There's also antifungal activity, correct? Many chronic sinus cases involve fungi, such as Candida.
Precisely. Laboratory work shows 0.5 to 1% DMSO inhibits multiple Candida species, and historical data from 1965 documented success treating dermatophytes like ringworm when DMSO was paired with antifungal agents, hinting at broad-spectrum respiratory benefits.
Listeners should know concentration matters. Over-the-counter DMSO often comes at 99% purity, which must be diluted. Consult a knowledgeable practitioner before topical or intranasal use, and verify medical-grade sourcing to avoid contaminants.
Correct. Never self-administer high-strength DMSO into nasal passages. A typical protocol studied was 5 to 10% solution, applied under supervision. Safety precautions include glass containers, clean skin, and avoiding synthetic fragrances, which DMSO can carry through tissue.
We've covered a comprehensive toolkit: mechanical flushing, moisture strategies, environmental controls, targeted nutrition, sunlight, essential oils, and DMSO. What closing guidance would you offer to someone facing recurrent sinus flare-ups?
Track triggers. Start with low-risk options like hydration and neti irrigation, upgrade your diet, and evaluate mold exposure. If infections persist, discuss adjuncts such as DMSO with a qualified professional. Integrated habits often outperform isolated quick fixes.
That wraps today's discussion. By respecting the sinus's role and treating inflammation at its source, you can breathe easier without relying on pharmaceuticals. Thank you for joining us on Dr. Mercola's Cellular Wisdom.
We appreciate your time and curiosity. Stay informed, stay proactive, and we'll meet you in the next episode with more science-backed insights for vibrant health.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.